My name is Anisa Yalom, and I'm a hand surgeon. So I specialize in treating acute and chronic problems of the hand, wrist, and forearm. So acute problems would be things that would send you to the emergency room, such as fractures or saw injuries or automobile accidents resulting in crushing injuries of the hands or from whatever source. The most common things that I treat in my practice are carpal tunnel syndrome, trigger fingers, tendinitis, and wrist fractures and wrist reconstruction. So if there's any possibility of treating my patients non-operatively with things such as splinting or steroids for these chronic conditions, I usually try non-operative management first. But there are some conditions that do require surgery, such as fractures or tendon lacerations or nerve lacerations. My goal is to get people back to normal functioning of their hands as soon as possible, and also supporting them through their rehabilitation process. Hand surgery is an incredibly technical field, extremely precise and very careful surgery. It requires a knowledge of the anatomy of the hand, which is usually very predictable. It's also very beautiful. But when there are injuries or tumors or other problems that can disrupt the anatomy, it's important that the hand surgeon understands how to go about treating the injury without injuring any other structure in the hand. Expose the structures that need to be repaired or treated without injuring anything else on your way in. Occasionally, I do reconstructive surgeries of the hand for people who have things like saw injuries, and I may need to borrow tissue from one area to transpose it into another area. And these are vascularized pedicles or innervated flaps so that people can have a close to normal functioning of their hand after having devastating injuries. These are surgeries that are performed most often with an operating microscope so that I can be sure not to disrupt the important structures of the hand and to preserve the arteries and nerves in the fingers. Personally, for me, hand surgery is extremely gratifying because I enjoy the technical challenges and the precision required with the surgery that I perform. While I offer highly personalized care, I'll take the time to listen to my patients. I don't rush them out the door. Each patient is an individual and has certain desires or certain goals that they need to meet in order to recover from their injury. And I enjoy hearing about my patients' lives, and this gives me extra information about how to best help them get back to the best that they can be. I want my patients to feel confident that I will give them the best technical surgery possible, and that they will also be listened to as individuals and treated with warmth and kindness. Well, it's important for my patients to have full confidence in their surgeon, both in their technical abilities as well as the care and the kindness with which they'll be treated. I speak English and Spanish and French, and I enjoy speaking with my patients in all of those languages. Patients should come and see me because I'm a highly skilled technical surgeon who is very precise, but I also offer kindness and warmth and understanding for my patients, and I take the time to listen and hear their concerns.